Today's series of Docplexus KOL interviews, we have with us Dr. Shekhar Ambardekar. He's currently working at Asian Heart Institute and Fortis Raheja Hospital in Mumbai. Thank you so much, doctor, for the interview. So my first question to you is, what is the current status of heart surgery, especially coronary artery bypass grafting in India?
Okay, see, heart surgery is now widely available in our country, all over the country, and right from north to south and east to west. Bypass surgery is the most commonly performed heart surgery, and therefore, bypass surgery for an average cardiac patient is available all over the country. It is the most commonly done surgery. Okay, bypass surgery is needed for the patients who have got coronary artery disease, which is not amenable to angioplasty. These days, we cardiologists do more and more angioplasties, but there are certain situations where results of bypass surgery are much better than angioplasty. In those patients, certainly we advise bypass surgery. For example, somebody who has coronary disease and his coronary disease symptoms are not controlled with medical treatment are the patients who go for either angioplasty or bypass surgery. Angioplasty is these days available for more and more cardiac lesions. However, there are some situations where angioplasty is not as useful as bypass surgery. Complex coronary disease, left main disease, though more and more cardiologists are now becoming aggressive and going for angioplasty of left main, these days also standard treatment for left main disease is generally bypass surgery, especially distal left main disease where the artery is bifurcating into the branches. Secondly, multiple blocks, multivessel disease, especially in diabetes. A diabetic multivessel disease, long-term results are much better with bypass surgery, and that is accepted all over the world, because though initial results may look good, long-term results, especially repeat procedures, are more common with angioplasty in such patients rather than bypass. Therefore, bypass stands shoulder above angioplasty in such situations. Anybody who has got left ventricular dysfunction, multivessel disease and diabetes, bypass is better than angioplasty.
Okay. So doctor, moving on to my next question, how should one interpret that the particular patient needs bypass, and which are the main points that you would consider?
I talked many of them just now, that any patient who has got heart disease, it is not adequately controlled with medicines, and therefore he requires some procedure, and after doing angiography you come to know that the lesions are such that angioplasty is not as good as bypass surgery in terms of long-term results. There the patient requires bypass surgery.
Yeah. So doctor, my next question is, are there any post-operative complications for the same?
Yes, I mean, we can never say that there will be no complications, because after all it's a major surgery. Most importantly, patient requires general anesthesia for surgery. Secondly, the chest has to be opened. The chest has to be opened by cutting the middle bone, and the chest is opened, and then the chest is sutured back after the surgery. So, if any individual who has got bad lung disease and therefore after surgery breathing may become more difficult, can have these complications. Any surgery can be complicated by some infection. Older individuals, people with kidney disease, people who are diabetic, people who have got cerebrovascular disease are more likely to get complications of bypass surgery.
Okay. So lastly, I would like to ask you, what is the difference between minimally invasive and conventional approach of the bypass as an outcome?
Right. Though bypass surgery is commonly done by opening the chest in the middle, by cutting the breastbone, that is the only way, because we have to approach all the vessels, and the only approach may be that. However, sometimes a patient having a single vessel disease, especially the most important branch of the left called LAD. If that is the only lesion and the patient requires bypass only for that, then you don't need to open the entire chest, and you can have approach from the left side of the chest by cutting between the ribs, and there it is considered as minimally invasive surgery because you don't have to open the entire chest. Then of course the complications become much less because you are not opened the entire chest at all. Breathing also becomes easier for the patient.
Thank you so much, doctor. It was a pleasure having you here.
Thank you very much.
Thank you.